The famous scene that you see in all Bollywood movies, patient runs into the hospital, immediately we'll do an operation, they take him in and you do the surgery. No, reality doesn't work that way. Until and unless it is a life-threatening emergency, something like a aortic aneurysm or a aortic rupture. Apart from that, there is some surgical precautions we take before we do a surgery. Now, have you ever wondered why all your doctors tell you need to be fasting before surgery? They may tell you have to fast at least for about 6 to 8 hours before a surgery. And in case you're undergoing an intestinal surgery, the fasting sometimes may be a little longer also. Now, what happens or what is the science behind why you have to fast before a surgery? There is something called as gastric emptying time, meaning whatever food you have, the stomach takes some time to digest it and push it down into the smaller intestine. Now, this time is something called as gastric emptying time. So it is faster for liquids. Let's say you have taken water, gastric emptying time is hardly 6 to 8 minutes. But when you take solids, it's about 45 minutes to 2 hours. Depends on the type of food, multiple factors. So normally your surgeon, anesthetist whom you meet at the hospital will suggest you please have to be fasting for at least 4 to 6 hours before the surgery. What happens during surgery when the anesthesia is given? It is a muscle relaxant. So all your sphincters or the mechanisms that prevent acids and stomach contents from coming up get lax. So there's a high chance of after the anesthesia is given, the muscle or the esophageal sphincter may relax. That will lead to contents of the stomach going into the esophagus and sometime into the throat. That's what we call as aspiration. So aspiration, when the contents of the stomach or go into the lungs, it can develop into something called as a pneumonia or ARDS, and it is a dreaded complication. So ideally, we expect the patient to be fasting for this main reason. Sometimes doctors may allow you can take water maybe 3 to 4 hours before the surgery, but nothing beyond that, maybe a small quantity of water. To avoid a dreaded complication, this is a measure taken by your surgeons and anesthetists to prevent your lung infection and to protect your lung. So ideally you have to be fasting for about 6 to 8 hours before your surgery. Sometimes in case of intestinal surgeries, they may keep you fasting for about 24 hours and they may give you a laxative to cleanse your bowel also. So that depends on the type of surgery. This is not a hard and fast rule, but as a general phenomena. This is the main reason why we tell fast before a surgery. Hope this was useful. You can always share this video to people who may be interested and like and subscribe my channel. Thank you.